Lots of microphones. Good afternoon, everybody. As Lance said, Alicia Benson. I have the honor of being the CEO of Greater Spokane Incorporated. And a huge thank you to each of you and to the media for joining us today here at the Spokane Public Library, and to be part of a really important moment for our community. As many of us in this room know, Spokane is facing an unprecedented drug and mental health crisis that is straining our safety and health systems and affecting everyone who lives, who works, and who visits our region day in and day out. And today we're coming together to take action. Over the past year, leaders from across the region, many of whom are here in the room and sitting here behind us today, representing business, nonprofits, philanthropy, law enforcement, public health, housing, and those with lived experiences, have been working side by side to design a process that's transparent, inclusive, and community-driven. The Safe and Healthy Spokane Task Force is the next step. It's a public-private partnership committed to identifying actionable solutions that strengthen our behavioral health system, improve public safety, and better coordinate the systems throughout Spokane County. Today's program will introduce us to the task force conveners and the members of the task force, and we're going to share why this initiative is urgently needed. You'll hear from elected leaders, business leaders, public safety officials, and community advocates, each who bring a unique perspective and a shared commitment to building a safer and healthier Spokane region. To kick us off, we're going to hear first from Commissioner Jordan, followed by several of our community leaders who are going to speak to the challenges and to the opportunities. And then you'll hear from the board leadership of the convening organizations, Downtown Spokane Partnership, Greater Spokane Incorporated, Greater Spokane Valley Chamber of Commerce, and the Waters Meets Foundation. We're going to share how the collaborative effort has come together and what we hope to achieve. And finally, we'll close with both the task force and some of our key leaders joining us here on stage, and some remarks from Emily Cameron, the President and CEO of Downtown Spokane Partnership. And then we'll have an opportunity for questions from the media. The work ahead is going to take each and every one of us, public, private, nonprofit, and civic leaders collaborating. We have to stay focused on solutions, and today is about creating that momentum and inviting the community to both engage and stay engaged in the work ahead. So thank you again for being here and for caring deeply about Spokane's future. It's now my pleasure to turn it back over to Lance to lead us through the program. Is that up? Okay.
Okay, our next speaker is Commissioner Chris Jordan from Spokane County. Chris?
Well, thank you, Lance and Alicia. I'm County Commissioner Chris Jordan. I'm thrilled to be here today alongside a diverse coalition of leaders and community partners to offer my strong support for the formation of the Safe and Healthy Spokane Task Force. Commissioner Mary Cuney, the chair of the Board of County Commissioners, also asked me to pass along her support for this community-driven effort and to thank the impressive list of leaders committing their time and energy over the coming months to evaluate how can our systems improve and to help craft a regional action plan for a safer and healthier Spokane County. Spokane County is a fantastic place to live. We have so much to be proud of and thankful for in this region. And yet our residents know that we have our shared challenges, including too many of our neighbors in crisis, suffering from untreated drug or behavioral health problems, inadequate justice and treatment facilities, and a criminal justice system that's too often overburdened. We all want to see a safer and healthier community. And to achieve real progress, we can and must work together as a region. The county can't do it alone. The city of Spokane can't do it alone. And just take a look at the folks supporting the creation of the Safe and Healthy Spokane Task Force, many of whom are here today. We have county leaders, we have City of Spokane leaders, Republicans, Democrats, business leaders, nonprofits, healthcare, first responders, courts, crime victims, lived experience, civil rights advocates, labor, and I could go on. And I don't think it would shock anyone to learn we don't always agree on everything. But this effort is about trying to find the common ground wherever it can be found. That's what the public deserves. 2 years ago, when the jail measure was on the ballot, Sheriff Knowles and I had a very cordial public debate at the Rotary Club on that issue on opposite sides. And today we're all standing here supporting the formation of this task force to help move the entire community forward on public safety. The good news is we're not starting from scratch in this work. Spokane County has a history of working together in this area. Our already successful Crisis Stabilization Center is a shining example of law enforcement diverting individuals in crisis to treatment instead of jail or the emergency room when it makes sense to do so. The county is already working to expand that facility with the help of $3 million from our state legislature, funding the city of Spokane supported. The county, the city, and the city of Spokane Valley are also co-investing opioid settlement funds in effective sobering and triage beds through STARS, Spokane Treatment and Recovery Services, that have already helped over 1,000 residents in crisis, connecting the vast majority of them to longer-term drug treatment options with a low recidivism rate. But there's so much more that we must do. And the action plan that we need is about more than just the jail. It's about the whole system. The community-driven task force, modeled after a similar successful coalition in Whatcom County, will bring together a diverse team of dozens of experts and local leaders to examine our public safety and justice systems from beginning to end, with a special focus on reducing recidivism, effectively responding to behavioral health crisis, and asking, what would it take to get better results? What is working well that can be scaled up? Where are the gaps? How can we better coordinate? What facility improvements are needed? And the task force will gather wide input from residents across Spokane County so the voices of the people are heard throughout this process. I want to thank the business and nonprofit leaders convening this initiative, Downtown Spokane Partnership, Greater Spokane Incorporated, the Valley Chamber of Commerce, Avista, Waters Meat. I appreciate your leadership, and I look forward to seeing the good work of this task force going forward. Thank you very much.
Our next speaker representing the healthcare sector is Matt Albright, Executive Director of Service Lines with Providence. Matt?
Thank you, Lance. And just want to echo Commissioner Jordan's working together for the common good. We're the largest healthcare provider in the community, and we're seeing an unprecedented crisis around mental health and substance abuse. Just to give you an example, in 2024, our emergency department had 8,700 adult visits for behavioral health issues, which makes about 15% of the patients that visit our emergency department. Our hospital faces this crisis from the standpoint of dealing with what are truly medical emergencies versus things that can be cared for in the community through intensive outpatient programs and programs that we partnership with at Providence to include funding, which is challenged at this given point in time in today's environment. We're incredibly thankful for the task force being put together. We're incredibly excited about participating. And we also know that there's many issues that are involved in this specific space. For example, Commissioner Jordan mentioned the STARS program, Spokane Treatment and Recovery Resources. The STARS program has been monumental for us at Providence in our emergency department. If you have a patient that presents themselves that's under substance abuse or alcoholism, they can be presented to the sobering program for STARS on the spot, as long as they elect to do so, and be taken into that program, be given the resources that they need to include case management, regardless of insurance, regardless of ability to pay, and be treated in the outpatient setting. This has been a huge help for us, and our partnership that we want to work with the nonprofits within this community and an integrated service profile is going to be incredibly important. So we're fully committed. We're fully committed to the work, and we're fully committed to making Spokane a healthier and safer place to live.
Our next speaker representing lived experience is Angel Tomio Sam, Executive Director and co-founder of Yo-Yo Spokane.
Oops. Microphones. I'm Angel Tomio Sam. Good afternoon. I am first an Indigenous woman. I'm also the Executive Director of Yo-Yo Spokane and someone with lived experience in Spokane County's criminal justice system, including time inside that jail. I also served as the campaign manager for Justice Not Jail's Political Action Committee, where our community came together and successfully stopped the expansion of a new jail. I am part of the Safe and Healthy Spokane Task Force because I know what's at stake for real people. Our neighbors, our relatives, our community members. For more than a year now, we've been meeting monthly with local stakeholders across many sectors. We began with a visit to Whatcom County to see what happens when a community votes to build a new jail. That experience pushed me to stay even more committed to ensuring Spokane does not simply repeat the same cycle that we've had. My role here is to keep us grounded in the truth of what the Spokane County Jail really looks like and the deep impacts it has on people and families. But I also come with hope. I believe that through real community engagement, we can create solutions that benefit all of us. Solutions rooted in health, housing, and justice, not just incarceration. I am committed to advocating for people mostly affected by the system. And I truly believe that if we come together as a community, we can build something better than a bigger jail. We can build a Spokane that is safe, healthy, and just for everybody. Thank you.
Our next speaker, Sheriff John Knowles of Spokane County.
First of all, thank you everybody who is in attendance today, and thank you to the men and women who are sitting behind me who have chosen to give their time to truly make a difference in Spokane and the way Spokane is experienced by those who live here and by those people who come to visit. It is no secret that for the better part of 15 years, we have been dealing with challenges in our criminal justice system, and I'm speaking far broader than just a building like a jail. The criminal justice system as a whole is overtaxed in this region, meaning there's a lot more demand for the services than we've been able to provide. And our citizens should expect that we have a justice system that does deliver justice, but does it in a way that is humane to those people who do violate the law and are held accountable. And far too often, the policies that we've been implementing for the last better part of 2 decades to maybe 15 years or more have been policies driven by our capacity to handle things in a humane way and provide justice. And I think along the way, we have seen that the safety of our community and the open spaces that we experience in our community have degraded because of some of those policy decisions we've had to make. What is going to be unique about this group of people we have assembled is they are from all different sectors of the public. Businesses, hospitals, mental health, treatment, law enforcement, and the criminal justice system. Because we have to make sure in a time when our financial resources are limited, and that means our families' financial resources are limited, that the tax dollars we do collect, that we are using them to the most effective level that we can. And I'm excited that we're going to have community input from this group to give suggestions to the county commissioners and other elected officials who will decide where we have to spend these valuable and precious tax dollars to make sure that our communities are safe for everyone. And as your sheriff, I can say that this is much needed, and there are going to be many solutions that we're going to put in place that hopefully in a short period of time, we're going to be able to leverage the money that we currently have on our expending to the public's best benefit, but also any future monies are being spent wisely and in the best, most effective places. And that is something that we as law enforcement officers across the county need, and it's something that the public deserves. Thank you.
Our next speaker will be Mayor Lisa Brown from the City of Spokane.
Thank you. Thanks, Lance. Mayor Lisa Brown, we're at an important moment for our region. The formation of this task force made up of people, as you've already heard, with diverse experiences, but also expertise in behavioral health, public safety, public and private government and organizations. Coming together as we are marks a pivotal and positive moment for our region, because we are committed together to carefully crafting a plan that reflects our needs and our values, our common values of compassion and accountability. Right now, we know we have these pressing issues that we face. Not only the quality and capacity of our facilities, but also the challenges of building a workforce to staff those facilities. Also, the programming necessary to successfully navigate people to the appropriate place, whether it is treatment or a criminal justice facility. And furthermore, to navigate them through those systems to stability and back into community reconnected. So it's already been pointed out that we have these multiple diverse sectors represented. I think it's obvious we have multiple local jurisdictions here, from county to city to valley. We have all three segments of our government here. The executive branch, my administration is committed to this process. The legislative branch, the judicial branch, I see Judge Samlin here, will be part of this task force. And we also have all political, diverse perspectives represented, and all parties. And what I mean by that is Democrat, Republican, and none of the above. My hope for this process is that we meaningfully grapple with the root causes of criminal justice involvement, identify opportunities to invest in people and communities together, identify where current interventions come short, and collaboratively utilize those scarce and precious resources to get the best outcomes for people that we can. Imagine a system where everyone who needs treatment can find it, where the courts and our jail are stabilizing forces working with service providers and local governments to ensure continuity of care and successful return to the community. I am also very hopeful that we can do this. And it has taken over a year to get to this point, and that should not be seen as a negative thing in my mind. I think it should be seen as a very positive thing, a commitment to do this correctly, a commitment to make sure all the voices were included, a commitment to give this as good a chance as possible for success. The commitment that is represented here today is really a thing that also gives me hope, like Angel said, and that really is a turning point for us if we stay focused on maintaining the civility, the care, the coordination that has gotten us to this point as we move forward together. So that's what this task force is committed to, and the fact that we're here today demonstrates that commitment, that we have agreements, as Commissioner Jordan already said, but we're going to build on those for common investments. We can do better. We must do better, but we must do it together.
Our next speaker, Betsy Wilkerson, Council President, City of Spokane.
Thank you. We are very quiet and very serious for a very serious issue. But y'all know I never met a mic I didn't like, so I gotta say something right now. So there you go. Put a smile on your face. You guys are making me nervous out there, being so quiet. So yes, I am City Council President Betsy Wilkerson, and I am truly honored to be up here The task force is the next logical step forward in tackling our social challenges. You've heard it's been a year, and I am honored to have these people sitting behind me, but it's been a year of a bumpy road. That just shows the commitment we have. There are all types of climates, political, social, that are working against us to make this happen for our community. The regional strategy unites people with expertise, personal experience, and a deep understanding of how to address issues in our community, creating a truly community-driven initiative. I want to call out a good friend of mine, Katara, in the audience, who did some work on the Gabriel's Challenge that started the whole educational process for why we're here today, because so many people didn't have all the information or misinformation about what faces our community. So thank you for that, Katara. And this is just not led by government, service providers, or organizations. Instead, it is driven by a collaborative effort. While we will not achieve our goals overnight, it will require time, it will require patience, and it will require necessary compromise. Today, we celebrate this progress, and as we press forward, we really invite the community to be with us. Like it's been said, if it was easy, it would have already been done by now. City couldn't do it, the county couldn't do it, the jails couldn't do it, other municipalities couldn't do it, nonprofits couldn't do it, service providers couldn't do it. This is a holistic, collaborative approach of what our community needs and really how we show up as the people behind us, as elected or leaders in high places. Some of them might want them to be that high, but they're there anyway. How we work together. So I'm excited about collaboration. Collaboration isn't a word we use as much as we should, but if we use it in the right way, we will achieve the success we are looking for, not only for our city, but for every person that lives here, and that is the goal today. With that, I want to bring up my council mate, Councilmember Cathcart.
Yeah, thank you, Council President. I really appreciate that, and thank you to everybody who is here today. This is such a very important effort that is being undertaken right now, and I just want to say there's a lot that's already been said. There's not really a whole lot left to add, but I do want to say, as somebody who supported Measure 1 2 years ago, we can't repeat Measure 1. And I think what we see here is an opportunity for and we've heard it already, a diverse group of voices, but specifically to set aside personal, political agendas and to really rely on expertise and passions and find a way forward to put something before the voters, before the commissioners, before the community that will significantly improve public safety across the region and the county. We have, I think, a real opportunity. Now, the next 8 months, as this is working to come together, is going to be challenging. And we're all going to remain at the table. I'm incredibly confident at that. We're all going to compromise and find a way to achieve a solution that we can be proud of at the end of the day, and something that, because of the diverse voices and views that are up here, the voters will seriously consider and hopefully pass once it's before them. I think one of the other opportunities here is to really look honestly at the system. And again, it's been said, not just about a single building, but that building is a key part of the system. And we want to make sure that we are modernizing the system in a way that achieves accountability, but also opportunity for individuals who need the support and the help to improve their personal situations, their lives, and to hopefully avoid any future entanglements in the criminal justice system. Cost effectiveness is a really, really important aspect of this. And I believe that through this work and this effort, we are going to find opportunities for not just the facility, a jail facility, mental health and drug treatment type options, but ways to improve the criminal justice system overall that will be cost effective for the city, for the county, for neighboring jurisdictions, and also help speed up justice. And that, I think, is important not just for those who might be awaiting inside that building or awaiting for their charges to be heard, but it's important for the victims, for the community, for the entire system overall to work. And so I'm really excited about this opportunity that is before us today. I'm fully in support of this effort, and I am very grateful for we'll call them the founders of this effort here, Avista, the Downtown Spokane Partnership, Waters Meet, the Greater Spokane Valley Chamber, and GSI. And to have those individuals leading this effort at the table, putting their money where their mouth is, so to speak, I believe is going to make all the difference in the world. So thank you all very much, and I will turn it over to, I'll have you introduce Judd.
Our next group we're going to bring up together. Please welcome Judd Wendell, Executive Director of the Hutton Settlement and current Board Chair-elect of the Greater Spokane Valley Chamber of Commerce. Charlotte Nemec, President and CEO of Canopy Credit Union, current GSI Board Chair. Alicia Barbieri, VP of Goodale Barbieri and Downtown Spokane Partnership, current Board Chair, as well as Dr. Dean Martz, current Board Member for Waters Meet, formerly known as Empire Health Foundation.
Well, good afternoon. I'm Judd Wendell, the Executive Director of the Hutton Settlement Children's Home and Vice Chair of the Greater Spokane Valley Chamber of Commerce. As has been repeated over and over, today is an important milestone for our region. Challenges like substance abuse, mental health, and public safety affect families and businesses across Spokane County and the Inland Northwest. These issues don't stop at city limits, and neither can our response. That's why leaders from business, healthcare, law enforcement, housing, and nonprofits come together to create a regional, community-led effort that unites resources and aligns strategies. The Safe and Healthy Spokane Task Force is that effort. Diverse voices sharing responsibility and building a coordinated plan to strengthen behavioral health, improve safety, and create healthier communities. As incoming board chair of the Greater Spokane Valley Chamber of Commerce, I'm proud our chamber is helping convene this work. When we come together as a region, we're stronger and we can deliver real change. Thank you.
Hi everyone, I'm Charlotte Nemec, President and CEO of Canopy Credit Union and current Chair of Greater Spokane Incorporated. We've all heard it already, but the challenges we're facing are significant, from behavioral health to public safety to housing, and they impact everyone who lives, works, and visits Spokane County. There are incredible people and organizations working every day on these issues, but what has been missing is a coordinated table where solutions can be designed together. This task force creates that table, bringing together those diverse voices from law enforcement to healthcare providers to those with those lived experiences. This is the way to find a path forward. No single organization or jurisdiction can take this on alone. The Safe and Healthy Spokane Task Force is the outcome of our shared commitment, a community-led public-private partnership designed to align strategies and share responsibilities so that we can support a safer and healthier community.
Thank you, Charlotte and Judd, and thank you to everyone that's spoken today. As board chair of the Downtown Spokane Partnership and vice president of one of Spokane's longest-serving commercial real estate and property management firms with Goodale and Barbieri, I want to underscore why this work is so urgent for our community, especially for our downtown. This is a turning point, moving from talking about problems to building solutions as one community. This task force brings together diverse experiences, backgrounds, and priorities of leaders from across industry and geography. Each of us committed to listening, learning, and working towards actionable solutions we can stand behind together. The stakes are high, and the time to act is now with this task force. I believe we have both the urgency and the unity needed to make real change. I'm supporting this effort and choosing to be at the table as a member of the task force to support solutions that address the challenges we're confronting in our community every day. Spokane is ready for change. I am proud to be here today to support the launch of the task force and our commitment to real, lasting solutions. Thank you.
Afternoon, everyone. Dean Martz for Waters Mead Foundation. As you've heard, 18 months ago, concerned leaders from across the political spectrum came together for a path to a healthier and safer Spokane. We at Empire are proud to support the product of this 18 months work, which is the task force that you're hearing about today. Our challenges around safety, health, and housing require collaboration and shared responsibility. And this task force is a vital opportunity to align strategies and build stronger solutions, working together while putting our differences and distrust aside. We can make a healthier and safer Spokane for everyone. Our success will depend on broad community participation, and I look forward to the opportunities for residents, businesses, nonprofits, and civic leaders to stay engaged, share their voices, and help us move solutions forward. Together we can create a Spokane where people feel safe, supported, and proud to call this community their home.
Okay, we'll take your help to... There we go. Thank you. I'm Emily Cameron. I'm President and CEO of the Downtown Spokane Partnership, and thank you for the opportunity to be here with you and to each of our speakers today for your commitment to what is probably the most pressing and important issue in our community. As we close our press conference, I want to also reflect on those 18 months that we've spent together. We came together to ask ourselves a question: is there a better way forward? Is there a way that we can do this together? And today, we have reached that milestone with the launch of the Safe and Healthy Spokane Task Force. This is our answer, and you've heard a lot about the challenges and the issues that we are facing as a community today. They are complex, they are interconnected, and they are urgent. The work of the task force will not just be another study, another report, something that gathers dust on a shelf. This is a commitment to action, informed by diverse perspectives and backed by the resolve of leaders who know the cost of doing nothing. It's important to remember that the work of the task force is the work of all of us. We need the community. You've heard a lot about the different stakeholders, the businesses, the nonprofit leaders, the elected leaders, our community members, those with lived experience, and our residents. Each and every one of these sectors has to stay engaged, share their voices, and be a part of moving solutions forward. We're committed to a process that is open, it is transparent, and inclusive so that by next spring, a comprehensive and prioritized plan can be delivered to Spokane's jurisdictions in order to address the gaps and lay the framework for long-term solutions that will improve public safety and health outcomes for every member of our community. The task force will meet monthly starting this week, and they're going to explore strategies and opportunities, hear from national and local experts, explore the work that's already been done, that's underway, and consider public input all throughout the process. Our goal is to deliver a plan that outlines these strategies and investments that will strengthen behavioral health, improve public safety, and build systems and coordination that our community needs. We're not just looking at this from one angle or one jurisdiction, but every perspective across every jurisdiction in Spokane County. Our region is coming together in new ways, and that gives each of us great hope. We still have a lot of work to do in order to respond to the needs of our community and create a safer, healthier Spokane. But with this shared commitment, we can support a place together where people feel secure, supported, and proud to call home. So on behalf of the Downtown Spokane Partnership, the Greater Spokane Valley Chamber of Commerce, Greater Spokane Incorporated, Waters Mead Foundation, and our partners in Avista, we are proud to stand with all of you and the work that we are about to achieve together in the months ahead. We have several members of the task force and those who have been with us on this journey for the last 18 months. I'm going to invite you to join us on stage. We want to demonstrate just how much time, effort, and community has been part of this effort. And for our media partners, we're wrapping up. We will be available individually for questions. You can continue to stay updated with the task force. A new website has launched today, safeandhealthyspokane.org. You can go online now. We want the public to submit their questions, their feedback, and as I said, this is a process that will continue to engage each and every member of our community. Thank you for being here with us.